Hi there, everybody. Welcome to our webinar. Just going to give team members a few minutes to join. Welcome today. We're expecting quite a number of people. I can see the numbers are starting to creep up. So in a moment, we will kick off. My name is William Roberts. I'm Chief Executive here at the Royal Society for Public Health. Welcome to our webinar today, where we're going to be discussing our new report, The Unusual Suspects, Unlocking the Potential of the Wider Public Health Workforce. I'm really delighted to be joined by my friends and colleagues, Dr. Jeanelle and Professor Fenton. Welcome, we'll be hearing from them shortly. But I'm going to start just by introducing our report and sharing with you a little bit of information about the report that's now available for you to read. So hopefully you can now see the slides. The report is out today. It's available to download from our website. It's a report that we've been working on probably for the last year, but actually its genesis was nearly 10 years ago when we first did work in this area, where we first identified the opportunity of the wider public health workforce. So over the last year, we've been working with a range of people through a whole range of different approaches to work out who are the wider public health workforce and what they can do. And as you can see from this graphic, the sheer number and breadth and depth of the people that we were engaging with over the last year to produce this report is huge. And as part of the report, we've been looking at the numbers that were developed back in 2014, talking about how many people do we think make up the wider public health workforce. And having re-looked at the numbers and the types of profession in there, we've identified that we think there's 7.75 million people in the UK who could be within that public health workforce. But more importantly, there's 1.5 million of those people who said to us through this process, we'd really like to be part of this workforce and do something greater than we do now. So what we've spoke to them about what they actually do, because sometimes when we talk about public health, it can be quite a generic term, but people have been really clear with us about the whole range of different things they do. And so people have talked about the different types of approaches they have to influencing the health of the public and protecting the health of the public, and the different ways in which they've worked with us to think that through. But also as part of this report, we've asked them about the support that they would want from us in order to make this work. So firstly, they've said that they would like there to be increasing funding for the public health system, which you would expect in a report about public health. But we do think it's really important that we have a well-funded and stable public health system in the UK. But actually more than that, the report has gone on to talk about the idea that creating pathways into public health and careers within it is really, really important to these people. So not just understanding that they want to be part of it, but how can they get into it and how can they also progress once they're within that workforce. Similarly, we know that they want to be recognised for the work they do. One of the things that came up consistently was people saying to us, we don't feel recognised for the work we do as a public health professional, and we'd like that to be something that can be done, and then also find ways for us to progress into the core public health workforce if that's what we need. And then finally, we know people have talked to us about the need for a coherent and joined up strategy. I'm sure Jeanelle and Kevin will talk about that shortly in a moment. When we surveyed our members and surveyed those in the wider public health workforce, 90% of them said that it was really important that we had that strategy, and the wider public health workforce should be a government priority. So thinking about things in an election year, we know there's a huge opportunity potentially to harness these people to really improve the health of the nation and to make us a strong and healthy nation as we go forward. So 4 recommendations in the report. The first is that we believe strongly that there should be a national strategy for the UK public health workforce. We think that needs to be across the 4 nations. There'll need to be some nuance and there'll need to be some differences. But fundamentally, we know that working together as a system, we could come up with a really strong strategy that would help improve the health of the nation. Secondly, we need to think smartly and collectively about how to resource, upskill, and support the wider public health workforce to maximise their impact. We know there's a range of things out there already, such as apprenticeships, training levies, and other opportunities to work in the system that could be harnessed if brought together to really build the skills of that workforce. Thirdly, we'd like to see those people better recognised for their contribution to public health and prevention. And then finally, we'd also like to see clearer routes into public health and ways to develop and be recognised for your expertise once you're in there. And we've done some work, which is available in the report, to talk about the work we've done there, but we'd also like to do that with other agencies in the UK. So I'm going to hand over shortly to Jeanelle. And if you are interested in getting in touch with us, these are the details. But Jeanelle, over to you for your reflections.
Great. Thanks, William. And excellent work done by the RSPH. It's really interesting report, interesting read, and very timely, I think. I love the title, actually, Unlocking the Potential of the Wider Public Health Workforce. It's great, unlock the potential, because it absolutely, huge potential. As a jobbing director of public health, I absolutely recognized in a local place that wide range of people working in all sorts of guises, all different parts of the system to improve the health of their population, to protect the health of the population, to reduce the inequalities in health that they can see that are very vivid at that local level, actually. So it absolutely. And now that I have the national role as Deputy CMO and lead for the Office of Health Improvement and Disparities, and also that, with CMO, that lead for public health more generally, it's really refreshing to see, and invigorating actually, to see this new focus on the public health workforce and the wider workforce that your report picks up. We do need this diverse range of skills, of backgrounds, and you're absolutely right, those clear routes and opportunities that people can have to progress in their careers. Individually, as organizations, and RSPH, you said this already, we'll be working on, business plans or plans in terms of the workforce. And then that's quite right. You have particular, there's a rich tapestry of organizations that meets the needs of, as you've described, this really vast array of people working in the wider public health arena. But I do think we do need a coherent, overarching mission, vision, purpose. And I think, having talked to RSPH, to faculty here from Kevin, and other organizations, what we need is that overarching mission, vision, and purpose, because I think it's really important when we speak to senior decision makers, but also in terms of making sense for the different organizations, for the members in our organizations, that we have a coherent approach. To that end, we've set up a small leadership forum that I chair. Kevin is on it. But we've also got this renewed public health workforce collaborative. And that's really the powerhouse for taking forward the consensus view on the mission, vision, and purpose. And RSPH is on that, faculty, ADPH, a wide array of partners that are working to develop and grow the public health workforce. We're going to be having a workforce summit in early May, just to ensure that we're all pointing in the same direction, because I think that's going to be really important, really helpful. But I think in terms of today, congratulations on the report, on the launch today, and the excellent work that's been done for it, and all the voices. You've really captured those voices of people in the report. Fantastic to see, and I look forward to working with you and others in the system on taking forward the recommendations that you've made.
Thank you, Jeanelle. Handing over to Kevin in a second for your thoughts and reflections. For anybody who's wanting to ask any questions, there will be a little bit of time for some questions and answers. So please do use the Q&A function to ask us the questions that you're wanting to about either the report or the stuff that we're discussing now. But over to you, Kevin.
Thank you, William, and good afternoon, everyone. I'm Kevin Fenton. I'm the president of the Faculty of Public Health, and many of you know that we are a membership organization for the specialist public health workforce, representing more than 5,000 members here in the UK and around the world. And in the Faculty of Public Health, we're involved with advocacy for public health, training and capacity building, and of course, ensuring that we have a robust workforce for the future. So I'm so excited to be here with you this afternoon. And let me start by congratulating and thanking the Royal Society for Public Health, both for inviting me to speak at this event, but also for launching this really important report on our ambitions for the wider public health workforce. Now, the faculty is absolutely clear that if we are going to achieve long-standing and sustainable improvements in the public's health, it will require action not just by the specialist workforce, but by everyone who touch the lives of members of the public who are committed to improving health and tackling health inequalities. And true success and the sustainability of the public health workforce will require both specialists and everyone else, the wider workforce, working together, being aligned with our ambitions, sharing best and promising practice, and of course, ensuring that we are moving together in the same direction. So, the wider public health workforce has always been critical to protecting and improving the health of populations here in the United Kingdom and overseas. And as we face increasingly complex challenges, whether it is the rising tide of infectious diseases and chronic diseases, the cost of living crisis, the impacts of the COVID pandemic, or of course thinking about the new opportunities and challenges, whether technological, AI, or other challenges, it is really critical that we're working hand in glove with the wider public health workforce. And this is because the wider public health workforce really brings a diverse range of expertise and perspectives to our public health practice. And we have to recognize these roles, and we have to leverage and make the best of the opportunities for developing these leadership roles as well. So the wider public health workforce brings new capabilities and capacities to the specialist public health workforce, and there are opportunities for us to work together to develop that leadership. This report is also timely because it aims to help to understand and unlock the ability of the wider public health workforce to impact the health and well-being of local, regional, and national populations. And nowhere is that more clear than what's needed now, as we know that there are big issues nationally with more people falling out of the workplace with poor health, with a stalling of life expectancy and a stalling of healthy life expectancy. And some of these impacts being seen and exacerbated in some of the more deprived parts of our country. So now is the time for us to think about all of the assets that we have in the workforce and how we align and support the wider workforce to be a part of the solution as well. So whether it is environmental planners or fitness professionals or researchers or carers, those working in the voluntary sector, and those working in so many other settings that play a critical role in supporting better public health, it is important that we recognize this wider workforce and we're working together to harness them. And that is exactly what this report does, because it is absolutely clear about the range of assets that we have, the range of professionals that are part of the wider workforce, and how best to align and to support their development. Now, as we've heard from other speakers this afternoon, working with the Royal Society for Public Health and other partners, the Faculty of Public Health has really sought to recognise and to celebrate the contribution of the wider public health workforce. And as the president of the faculty, it is my commitment that I will work hand in glove with the Royal Society of Public Health and all of you to continue to advocate for the wider public health workforce and to ensure there are opportunities for us to work more closely together moving forward. The recommendations within this new report really provide a blueprint for us to recognise the full potential of the wider public health workforce. A UK-wide strategy to develop the workforce, which should be well-resourced, which focuses on training and development opportunities, and proper recognition of the contributions of the wider public health workforce will be necessary if we're going to truly harness the assets that we have in our human resources, and if we're going to build better public health. So strategy, investment, as well as development will be key. The faculty will continue to work with our cross-system partners to advocate for this role of the wider public health workforce and to encourage this resourcing, this training and development. And we encourage members of the wider public health workforce to engage with the work of the faculty, either through membership, which unlocks access to our special interest group program, or by attending our events, or by supporting our advocacy work. You know, this is such an important time for public health policy. And in a year where we may be having both national elections, regional elections, and many elections globally, And in a year where there's so many threats and challenges to the public's health, but opportunities for us to do more together, now is the time for us to ensure that all of our colleagues working in public health are doing so in a supportive, collaborative, and an aligned way. Thank you, Will and RSPH colleagues, for launching this excellent report. And we do look forward to working together to support better health for all. Thanks, Will.
Thank you, Kevin. And there's some lovely stuff in there, and I'm sure we could spend quite a lot of time unpicking various bits of that. But I guess just for yourself and Jeanelle, one of my questions, we're a Four Nations organisation. We work across the whole UK. I know the faculty also do. What do you think we can do more to try and join up the thinking across the Four Nations around workforce? Because obviously people move, people go to different parts of the country. But also there's something about the idea that, public health for the UK wide is really important and isn't necessarily boundaried by the local government structures that we have at the moment. What are your thoughts on that?
Jeanelle, would you like to start, or shall I?
Well, you can start, Kevin. I mean, the faculty is a Four Nations faculty. I guess, so interested to hear, I know that you've done work across all nations, Kevin, on workforce. I guess my role, and as for OHID in the Department of Health, it's England focused. That being said, we work closely with the other chief medical officers, deputy chief medical officers, so attuned to what's going on across the Four Nations. But in terms of workforce issues specifically, I think Kevin probably, and we need to think Four Nations, but Kevin, your views on that?
Yeah, no, I agree with you, Jeanelle, and it makes sense to be approaching this UK-wide, in part because there are lots of innovations and different approaches to the delivery of healthcare systems in the different nations. So there are going to be opportunities for us to learn from each other, identify best and promising practices, and ensuring that we're developing the workforce together. Second, bearing in mind that there's a lot of movement across the United Kingdom of the public health workforce. So it is in our interest to ensure that we are both looking at how we support the workforce to do that movement, but also that we're focused on standards, training, how we develop and how we support our public health workforce. Finally, it is really important that we think about the capacity and strategic planning on the workforce, and that it's a UK-wide strategic planning. So even though we do a lot of work with OHID, the NHS in England, we're also sharing what we're doing strategically with the other nations, because we want to ensure that we have a shared vision for the future for the workforce, the new capacities which will be required, the new standards that will be required, and doing that on a UK-wide footprint makes good sense. So there are a number of reasons why it's so important, William, and that's exactly what we're doing with partners like yourself.
I think there's, for us, I think the importance of working with industries as well. They tend to be working across borders and not bounded by the same public sector organisations we have. And we've certainly seen, talking to different types of industry, what they want is some way of being able to be recognised, but also have consistency. I think one of the things that has come up in one of the questions, and I guess this is sort of a wider piece for us, is that there's been a sort of proliferation of different types of jobs that broadly sit under the public health banner, one of which being population health in the NHS. And I just wonder your thoughts on how we can sort of almost make it simpler for people to understand that we're all one big family and it's all similar parts of the same process. What are your views on sort of the emergence of different words for effectively public health?
I'm happy to start on that one because it's a live issue for us in the Faculty of Public Health. William, terminology changes, right? I mean, 20 years ago, we were speaking about community medicine and community health. We have moved into public health and certainly in the NHS thinking about population health. And we have been working with partners such as yourself on having clear definitions about the difference between population health and public health, and understanding the sort of training, ways of delivering activities, and what it actually means to improve the health of populations versus public health. This is probably not the call to go into the definitions now, but what I wanted to highlight is this is an area where we welcome this new interest in population health and population health management in the NHS. We welcome, as a faculty, new skills, new professionals who are coming in to doing population health work. And what we want to do is to ensure that they are aligned to and understand the role of public health practitioners, and where there are win-win opportunities for us to train together, support practice together, or collaborate, that we're maximizing it as well. Similarly, the faculty will have a key role to play with NHS and other partners on looking at standards, training and capacity development for population health experts. So we really want to be in that space where we're supportive and encouraging, but also looking at what's different and what's similar between our practitioners in both areas.
Thank you, Kevin. I think we're having a few issues with your sound there as well, just for a moment. So a little bit of rustling, but maybe that's there. Jeanelle, your thoughts on sort of, you know, the challenge of trying to be an inclusive but also manage standards. I mean, how do we find that balance between being an inclusive public health was something we, you know, wrestle with at RSPH as a education body? What are your sort of thoughts on how we can do more of that?
I think, and I hope my sound's okay. Good. I think, well, it's a tension, isn't it? And I think you're articulating that tension of, you know, being inclusive, having a fantastic, diverse workforce, having that skill mix. Some of that is pragmatic, some of that is cost effective, some of that is actually who do you need to be doing a job with particular communities or in particular workplaces. But at the same time, ensuring that we do have those standards in place that, you know, it's also saying public health is everyone's business, but actually at the same time, there are particular skills, capabilities that the different parts of that diverse workforce, you know, they do need to be kind of skills and capabilities that are acknowledged as part of particular parts of the workforce. And I think we do need to maintain that. We do need to maintain those standards because, you know, but do that in an appropriate way. And so we do that in collectively, we do that through understanding and ensuring that we maintain that focus of what's going to be best for populations, for population health, for health improvement. And how do we ensure that we have influence, that we have impact? So I think that's really important, and for sustainably for the longer term. So we need to be, you know, pragmatic, savvy, and focused on that, which actually is a good. It's inherent in the public health workforce because, you know, working in a prevention space, working in health improvement or health protection, it's not easy. It's not there aren't open doors everywhere. There aren't pots of money everywhere. And rather than all sort of scrabble and kind of compete for you know, for that recognition, for the pots of money and so on, I think that's why the work that you're doing, William, the work that the faculty is doing, the fact that we're coming together today and showing how we're working together, what I talked about in terms of the leadership forum, the workforce collaborative, which again brings together a wide range of partners to bring together all those interests and insights and experience and knowledge to try and really strengthen collectively the public health message, I think, is really very important.
Thank you. And I know some of the work we've been looking at the moment about how do we build, you know, pathways and packages of education rather than just having people going through episodic work is really important. One last thing that came up quite a lot. I was talking to a pest controller this week, and they said that for them during the pandemic, being recognised as a key worker was one of the most powerful things that has happened to them. What are the ways in which you both think we can start to recognise people's contribution better? Because, you know, there is a view that historically those of us in public health have been slightly snooty about some of the other parts of the system, and I just wonder, you know, what do you think of sort of some of the ways we've talked about some benchmarks and some, educational training programs that people can be accredited by and memberships of different organisations. But are there things you think that we could start to do to recognise people's commitment and role in public health rather than almost having to seek it out?
Yeah, I think there are a few things, joint training, looking at how we bring and open conferences on public health, not just to specialists, but to the wider public health workforce. So there's value and respect by working with and opening it up to different practitioners. And I don't think, William, we do enough of that. We tend to have events for specialists and events for the wider workforce, when actually we should be thinking about, let's talk about the public's health and who is involved in doing that. I think we can do a much better job of telling the stories of the wider workforce, not just from RSPH, but taking some of the case studies and celebrating them. The faculty will be really happy to do a feature on the wider workforce, so we can begin to make those connections. And there's nothing more powerful than a story that brings us to life as well. And then finally, there's something for me about celebrating success. Where the awards that are given either at the LGA conference or other big conferences that celebrate the innovation and impact of the work being done by the wider workforce, how do we do some of that? And that will help to raise awareness as well. Thanks.
And of course, we've got the RSPH awards. I know I'm sitting on one of the panels, I think, William. So I'm really looking forward to hearing all the amazing, wonderful work that people are doing in all sorts of different places. I really look forward to that.
Yeah, that's the most amazing plug that wasn't actually placed there as well. I'm just going to say that. So, yeah, the awards are open. We've got about another 2 weeks till they close. So if you would like to put yourself forward for an award, please do. It's absolutely true. The awards are there for that. Jeanelle, Kevin, thank you so much. I know you're off to other things now, but thank you very much. It's been great having you. I'm going to pick up a question we've got here about, is there a plan to develop support pathways that the wider workforce could look at? Both the idea of working with the UK PHL register, which is developing and provide recognition of their work through a public health pathway. Aaron, you're the person in the team leading. Just introduce yourself to the webinar and then just talk a little bit about what you're doing on pathways.
Hold on. Hi everybody, I'm Aaron Mans, Head of Education Assessment at RSPH, so I look after our qualifications. Lots of familiar faces and names in the chat, so good to see you all. Yeah, very good question, something that we've been working on for a little while, plan to launch later this year. I would say we need two kinds of pathways in this space. The first are set-specific ones. So if we've got parts of the wider public health workforce which are quite well defined, people have told us there are lots of what I would call broken ladders. So in lots of those sectors, we've got clear entry points at maybe level 2 or level 6 and 7 high levels, and lots of missing rungs in between. So one thing we're working on is working with partners in those sectors, from pest control to infection control, to look at how we can fill those gaps with new products, which I think is really important. And the second is there's a need for something big, and I think Luan put this in the chat around recognising transferable skills. We've got lots of amazing people in different parts of the wider workforce. From volunteers, I think it was Clara mentioned recognising volunteers. I met with a charity yesterday who they've got a team of 40 volunteers who provide the most amazing perinatal support to families at a really vulnerable and important time. Do incredible work and absolutely should be recognised as part of the wider public health workforce. So something that we're currently developing with partners and we're hoping to launch later this year, and we're child in the report, is a pathway that recognises those transferable public health skills. So I think everybody from a hairdresser to a link worker has a chance to talk to somebody about their health and well-being every day. And it's how do we recognise those skills, their practice, and also their CPD. So if they take a qualification or a training product or they attend a conference, how do we recognise that and celebrate those people as a valued part of the wider workforce? So that's something that we're definitely going to be launching later this year. And if anybody would be interested in working with us on that, then we'd be keen to take that forward with you.
Lovely. And one of the other questions we'd had in chat was about how can we start to think about like early years, so school and school leavers as well, because this, obviously we've talked a lot about people in the workforces, but what sort of work are we thinking about in terms of embedding public health training and public health messages into schools?
again, I think there's a real gap. My background's work in education, and I start every session with young people to ask them to name careers in health and wellbeing. And once you got past doctors, nurses, dentists, there often wasn't a lot more. And public health, I don't think ever came up. We've done for a number of years, we've had a program called Young Health Champions, where we've given young people in schools, colleges, universities the skills to talk about health and well-being and to promote those messages to other young people. And I think anything that's peer-led, particularly with young people, is so much more impactful than input from a professional or an authority figure. So we're in conversations with lots of our partners who are doing similar work. There's great schemes from Barnardo's, from the NHS Cadet Scheme, St John Ambulance, about how we bring that together. And in a similar way, recognise those transferable skills. So how can we get young people? Young people often aren't very good at shouting about their skills and knowledge. How can we get them to recognise that the skills they've got are really important? And how can we start them thinking about what that can mean for a career across the breadth of the wider public health workforce? So again, if people on a call who work with young people, really keen to look at that with you. But I'd really recommend brilliant work by partners like Barnardo's and St John Ambulance to give those entry points, as well as the progression pathways. Often we get people at all levels coming to us saying, I'm at this stage of my public health career, I don't know where to go next. Or it could be people who don't know the entry points. So how can we make those entry points really visible for people at the start of their career, people looking to change career, and make sure they're aware of those transferable skills that they've got to make those changes happen.
And obviously, the role of school nurse is critical. I know a huge part of our work has been working with the School and Public Health Nurse Association to think through some of the work around how do we support school nurses and really, value those body as people who can work in, public health. And I think there's been a real challenge for that particular workforce over the last couple of years, with some real challenges around both recruitment and retention, but also being valued. I think that thing we've heard before about recognition. I mean, Indigo, one of the questions we had in the Q&A was about the sort of the sheer breadth. How do we sort of draw a line around this group? I mean, do you want to talk a little bit about some of the different types of organisations we heard for and types of professions we heard for? Because I think it's a huge number of professions that responded and we were engaged with during this work.
Yeah, absolutely. And I think in the slides that you shared, you can see, and also in our report, our word cloud, which just shows the massive breadth of different occupations, from kind of cleaners and pest control, planners, nurses, school nurses, midwives, teachers. It was a really wide range. And we also had a roundtable earlier in the year, which we talked about in our last webinar, where we brought together leaders from a number of these occupational groups, I think kind of 15 or so different people from across the sector into one discussion. And I think that was a really useful thing for us to do for our engagement work, just to see that despite the kind of breadth of different occupational groups, there was real agreement in the things that are still needed in terms of kind of recognition, value, and the idea of having like a national kind of strategy or plan.
There was, to add to that, there was a real passion across all those different occupational groups to do public health and to build on the public health approaches that they were already taken, from cleaners to pest control people to school nurses. So it was it is a massive group, but I think they're quite united in the fact that some of them are doing public health, some of them want to go further in the occupations that they're doing.
Idea, isn't it, of how do you create for those people support to do that, recognition to do that, but also the time and funding it requires to do that work. We'd had we know our friends at Simsbar are doing really great work around the standards in terms of education and leisure staff, and Lynn had sort of asked the question in the webinar chat about they're already doing that. So how do we think about things such as accreditation and recognition for being part of the public health workforce? Because people do stuff all the time, largely unseen, but what might be some of the ways in which we as an organisation can start to think about recognition, Aaron?
Yeah, absolutely. I mentioned shout out Simsbar, and I see colleagues from FutureFit on the call as well. A really good example of how you do that through a new sector, through leisure and fitness. But yeah, one thing we're looking at through the pathway is once somebody has got that evidence of learning and their contribution to public health, is how can we recognise that as a body? So could they be an associate member of our pathway programme, and we give them something that validates that experience and contribution. So I think I think for going back to volunteers as well and individuals in those kind of roles, that recognition and the confidence it gets from being recognised is so important for the contribution that they make. So I think that's a key one for us. And I think as well as looking at it in a linear way of progression pathways, I think it's how we recognise those adjacent opportunities as well. I mean, going back to Future Fit, for a number of years, they've done brilliant work around nutrition and mental health as a combination. So it's how do we spot those adjacent opportunities for people in the wider public health workforce to do a bit more or to do something different. And I think with that, the acknowledgement that they are addressing multiple areas of health and wellbeing, that's another way to recognise their contribution. We've done a lot of work with infection control, for example, for tattooists in Wales. They've changed the law recently to make it mandatory that anybody doing any kind of non-surgical procedure has to have an infection control qualification. There's a real opportunity there to introduce things like mental health qualifications and complementary things that can take that workforce to the next level and really show, as I say, their contribution to holistic public health, not just the day job, so to speak, but the other areas of health and wellbeing which make them a more well-rounded practitioner and show their impact.
And I think the challenge, isn't it, is how when there's so many different parts of the system, you can bring it all together. I think that's one of the reasons why we've been talking about the need for an overarching strategy for this. And I know there's some various comments about, I think, equity at the heart of it that we've had. So, questions around how do we make it easier for people who aren't coming through, if you like, the traditional routes, people coming through apprenticeship routes, people looking at apprenticeship degrees, people people in low paid carer roles. How do we create equity for those people? Because I guess there's always been a very clear path into public health at the higher educational end, if you like, through the training program. But what can we do for people coming in through less traditional routes, do you think?
I think the community, I can see Hannah Byrne from Owen's on the call, but I think the community health and wellbeing work apprenticeship is a really good place to start. It's a level 3 apprenticeship standard that it was PHE at the time pulled together, taking the model that worked really well in other countries around the world. But I think that's perfect. I think if you put that in front of somebody in a school or college who'd perhaps not seen public health before and they went through that standard, I think they see lots of skills that they have in their day-to-day life that they could use in a career that they've not seen before. So I think definitely apprenticeships. I think I've seen a comment as well about putting public health in the PSHE curriculum. Outside the day job, I'm the governor at a school and I have the PSHE link, and that's exactly my intention. So if we can use it as a pilot site and then expand it, that would be great. But I think it's about maximising those entry points to help with that. One is building the pathway and that conveyor belt for somebody to progress and use their transferable skills to go as far as they want to go. But I think a really important part of that is getting those entry points right, having as many of them as we possibly can, and then making them truly equitable. And I think they'll probably look different for each setting we have those entry points in, whether they're starting from school, college, university, and those paths. And it's also those entry points for people wanting to move across. So those two parts of the piece of the puzzle both have to be equitable, the entry points and the progression pathways. I think we've got a long way to go on both of those at the moment.
And I think, we identified, I think, nearly 180 professions that potentially want to be in the wider public health workforce. And I know next week we'll be releasing some of the data and methodology behind that, which, talks about that. And that includes teachers, and that includes people who are working, in roles that perhaps haven't traditionally been seen as public health. But I think there's something really interesting in there. I guess there's a few people have mentioned volunteering, and I always feel that one of the challenges of the pandemic was we had this amazing volunteer response, and then we never really, as a nation, harnessed it. And I know part of the work we've been doing as a team is also looking at how do you start to then think about, if people are volunteering, there may be some training development and portable qualifications, I guess, that go with it. One of the things we've seen is people having training but not necessarily qualifications they can then take on into other roles or jobs or sectors. And I just wondered, Phil, Indigo, Aaron, your thoughts on how do we make this also attractive to people who perhaps are either wanting to change careers or volunteering, as well as those who are in paid roles?
I think one thing that came across in the engagement work that we're doing is that people that are working across a range of different occupations want to bring a lot of them want to bring public health to the roles that they're already doing. So I don't think this is necessarily about taking people out of whatever career or whatever work they want to do. I think this is, for a lot of people, this would be about adding a public health element to the work that they're already doing, and that would hopefully kind of lift them up in terms of future career opportunities, would increase the impact of the work that they could do, would make them feel perhaps that they're contributing more to the health of the country. I'm not quite sure if that's answering your question, but that's what people said to us during the engagement.
Yeah, that challenge, isn't it? Of, you know, I've got a job, but I want to do more, and that in public health as well. And I know you've done some work around things like social prescribing models, volunteer models, and other work in that space. And just wondered if you had thoughts on
that. Yeah, absolutely. I think the key for that question is the tangibility of the pathways. So I think if people are going to make that jump, I think they need to have some confidence that those routes are there for them to progress and that they lead to something tangible at the end. It's very easy for us to say, it'd be great for you to go from level 2 to level 3 for a qualification. But I think what people want to know is, if I get to level 3, what does that mean for my career? I think it's the same at every level of the pathway. So I think we need to give them some confidence and reassurance that if they do make that jump, they've got the skills and knowledge to make that jump successfully, and that there are routes for them to progress from there. So I think that's key. But I think Phil's point about helping people to do that bit more, those adjacent opportunities, I think that's a huge untapped resource for us. I mean, speaking to friends in pest control, I mean, they said that if you're calling a pest controller out to your house because you've got a bed bug infestation or you've got a rat in the garden, whatever it might be, at the point you do that, you're probably pretty anxious. If you've got kids in the house, or the house is upside down, there's cockroaches coming through the sink, all the nasty stuff that they deal with, then the person making that call is probably pretty anxious. So they would really like some training around mental health awareness and health support, because they see a real need for them to make that impact. So I do think there's that opportunity as well, that we a big point of this is those entry points into different career routes, but we shouldn't neglect the fact that there's so much untapped potential in working with the current workforces to help them to do that a little bit more, or something a little bit different.
Right, and just Indigo, just coming to you. Couple of questions we've had, a couple of comments about where can we go to get more information on this work. What are the sort of things that we've got available for people if they're interested in finding out more on this?
Yeah, so we've got mostly on our website. We have the report on there which people can download, and also a shorter briefing is available as well. I would signpost people to our Allied Health Professionals Hub and Emergency Services Hub, and we have like a number of kind of careers pages. I think also we have a number of blogs on our website that we've been doing kind of throughout the year, and during our public health workforce week in October, where we post a number of blogs from members of the wider public health workforce, some of whom gave really, really good advice about how they got into that career and kind of what they would recommend to other people. I think particularly Nazreen, who was in our previous webinar, who's a health inequalities lead, she talked a lot in one of our blogs about different networks that she was part of and how that helped her. So I think someone will put some of these links into the chat for people to go to, and also we'll put our policy email up at the end. So if anyone wants to get in touch about the report or any particular pieces of work, you can just email us as well.
Yeah, I can see some things going into the chat. So if you're interested in clicking or getting any of those resources, please do. In a moment, I'm going to come to our video, which I'm reliably informed is going to work this time with sound. So when we come to that, just any last thoughts from the team about anything in the report that you would want to say to the people on the webinar?
I think I would just say that any help and support in building those entry points and pathways, we need to work with partners to do that. So if anybody has got an interest in working with us to design those missing rungs of the ladder, or to look at the pathway or those adjacent opportunities, then that's our role. We're here to facilitate and not build things completely by ourselves. If anybody is happy to work with us, then our door's always open.
And we're always here. We always want to hear from the wider public health workforce about all the amazing and unusual work that they might be doing. We did a lot of engagement on this last year, and we're not going to stop doing that. We're going to carry on. We've got our RSPH membership. We'll be doing surveys to the wider public health workforce. So our learning on this which informs then what we're going to call for governments to do, and what we can do as an organisation isn't going to stop here.
Lovely. Indigo, anything from you?
I mean, I think very similar to what Phil and Aaron said, you know, if there's something that you see that you're interested in that we're doing, please just get in touch. And yeah, we're going to be doing some kind of additional blogs and pieces that will be coming out in the next few months. Like William said, there's going to be one on kind of the numbers and the methodology from the report. And I think in May, we're hoping to do a piece on women in the workforce as well. So I would just say to people to, yeah, look out for our additional pieces that will be coming out.
Right, so for me, I think download the report, have a read of it. I think it's a really good report. There's loads in there. You can visit all of the resources on our website. We're now going to go to the videos, just a couple of minutes long, but I think they give a real flavour of what we're talking about with the wider public health workforce.
Hindle, and I am one of the Deputy Chief Allied Health Professions Officers for England. Like all of you, I have an ambition to improve the public's health. And I have the privilege of working with the 15 allied health professions and the police, fire and ambulance services to increase the contribution that those colleagues make to improving health and wellbeing as part of their roles, and to increase recognition of what they do as part of their jobs. So these colleagues are part of the wider public health workforce, which is championed by the Royal Society for Public Health. And so I'm really pleased to work with the RSPH on their future ambitions to increase opportunities for learning and development and clarify career pathways, and to raise the profile of this important workforce. Thank you.
Hi everyone, my name's Nazreen Iqbal. I'm the Health Inequalities Lead working at West Yorkshire Integrated Care Board. I've always been really passionate about public health and been drawn to roles within that, but sadly never been able to work within a public health team as such. So I've worked for local authority, I've worked for a social enterprise, managing services like a childhood obesity service, etc. In my current role, I've been working with stroke teams and supporting them around a health needs assessment. I'm really pleased about the Royal Society of Public Health's report that's going to be launched around the wider workforce and untapping that resource. I'll be starting a new role within Rotherham Foundation Trust in the next month, and I feel this report will be instrumental in gaining support from our executives, where they can support us to do training and development with our frontline healthcare workers and porters, so that they can really have conversations with patients where they make every contact count on a variety of issues around weight management, around exercise, around quitting smoking. I feel like this report is really giving recognition to people who are working within a public health footprint, but maybe not necessarily working in a public health team. And I feel like this comes at a time where we know the public health budget is reduced, but actually we need to be creative about how we offer solutions to the public health wider issues. And I hope that this report will go about addressing some of those issues. Thank you.
Hello, I'm Denise Hanson, Commercial Director of the British Institute of Cleaning Science, more commonly known as BICS. Our mission is to ensure cleaning operatives are trained to be safe and effective in their roles and to promote the cleaning industry as a professional body. Since attending the Royal Society of Public Health's Open Day in 2023, BICS have been thrilled to attend events and speak on behalf of our members as part of a wider public health workforce. The RSPH drive to develop a national strategy linking the wider public health workforce is music to our ears. The cleaning industry is often seen as a Cinderella service. We work out of hours, and often it's what we don't do that's noticed rather than what we do. The call of the RSPH to recognise all the contributors working to keep the public healthy shines a spotlight on industries not often recognised in this manner. But if you think about your daily lives, cleaning impacts nearly every part of it. If you travel to work on a bus or a train, somebody cleans that. If you take your children to school, somebody cleans our schools. Your workplaces are cleaned to make sure that you can be healthy and effective in the workplace. The role that operatives play to keep facilities clean and hygienic is key, and it makes them part of the wider public health workforce. But it's also key to recognise, to operate safely and effectively for the operative and for the areas and the public that they interact with, training is required, and knowing what they're doing is key to actually making sure it's an efficient and effective service. The RSPH call to recognise the wider public health service is one that BIGS will happily champion. Thank you.
My name's Carl Richards and I'm the Operations Director here at FutureFit Training. Having trained health and fitness professionals for over 30 years now, FutureFit have been at the forefront of developing the physical activity industry, supporting leisure facilities and their employers across the UK to improve the health of the nation. We know that the impact that our workforce can have on the health and well-being of local communities and the population at large, and we've made it our mission to create the education needed so that they can confidently apply health approaches to their work. The RSPH report distills exactly what is needed to advance the role of the wider public health workforce, and FutureFit are thrilled to be able to support the physical activity sector in playing their part. We know that when it comes to attracting and retaining the best employees, some of the most important factors are further qualifications and CPD to allow for clear career progression, but also recognition of the skills and value that health and fitness professionals can also bring is vital. From specific qualifications like exercise referral and health coaching, through to programs such as transformational leadership, we want to build a skilled and diverse workforce so they can positively impact their communities and improve public health from the ground up.
Right, I think that really gives a really clear flavour of the different types of people that we spoke to during this report and kind of why this matters. Coming towards the end of our time now, thank you to the panellists. Thank you to both Kevin and Jeanelle for agreeing to speak. If you are interested in this work, please do go to the website and download the report. We've put a link into the chat. You can also find more details on our careers hub as well. If you're somebody who's working with policymakers or politicians, please do join the call for a national workforce strategy for public health. The 1.5 million people we've identified through this report are a workforce bigger than the NHS workforce combined. So if we could harness that on top of the NHS workforce, imagine the things we could do to improve health in the UK. Similarly, do download our report and read it. I think it's a really, really important but also informative read. If you're interested in getting involved and working with us, please do get in touch with the team. Our email is policy@rsph.org.uk, and you can drop us a line and talk about working with us. If you're an industry or a sector we're working with already, please do come and talk to us about how packages and pathways could help you and how we could work with you. But also, if you'd like us to work with you on some of the policy messaging as well that we could do in this space. Thank you very much for your time today, everybody. Hopefully you found this an interesting and useful webinar. Hopefully you're going to go and download our report and you're going to go and take it to your teams and think about the ways in which we can start to embed public health skills across the wider public health workforce. Yes, we can definitely put that email into chat. So if we could just put the email into chat for everybody. And also it's policy@rsph.org.uk. Anyway, thank you very much for your time today, everybody. It's been great having you on this webinar. I look forward to speaking to you soon. Please do sign up to membership for us if you'd like to get more information from us about the services we provide and the work we do. If you're interested in any of the work we're doing, just get in touch with us and we'd love to work with you. Thank you.